University of Ottawa. Welcome to the show, Dr. Deonandan. How are you today?
I'm doing well. Thank you for inviting me.
It is a pleasure. Question number one: do you speak any Indian languages? Hindi, maybe?
I speak a tiny bit of Hindi, but I would not attempt
Okay.
to do so on live radio.
Okay. Well, try to throw in a few words here and there. Deonandan, what is it? From Caribbean, are you?
Yeah,
Or
I'm from Guyana. I was born in Guyana.
from
My
Guyana?
family
Okay.
originally is from North
Okay.
India, we think.
Yeah, it would have been Devanandan in
Exactly.
India, but in
Exactly.
Caribbean it became Devanandan. But anyways, welcome to the show, sir. It's a pleasure. Now let's get to the topic here. I've been reading your name in the newspapers quite a lot. You came up with, you say that positive symptomatic screening could also be useful. How useful would that be when we are dealing with COVID-19 and especially this fastly or very rapidly spreading virus that we have called Omicron?
Omicron, yeah. So the problem is that Omicron spreads so quickly that many people are going to get exposed and infected in a very short period of time. So many
Hmm.
people that the testing apparatus is not sufficient to that need. So we already have people in major cities across the country lining up to get PCR tests and being turned away because the testing facilities just aren't sufficient. So many places are reserving the PCR test for healthcare workers and other essential workers because they're the ones that need to know if they are infected so they can get back to work. For the rest of us, if we can't get access to a PCR test, what can we do? Well, rapid tests are
Hmm.
useful, but again, there's
Okay.
a run on rapid tests and a lot of people can't get a hold of them too. That leaves us with symptomatic screening. So
Hmm.
if you have all of the symptoms,
Now,
and
before we
sorry,
proceed, symptomatic screening, it sounds good, but what exactly, in your own words, how would you describe symptomatic screening?
it's it's determining if you are infected based upon the symptoms that you show. It's not precise,
Hmm.
high rate of error, obviously, because
Okay.
COVID symptoms are the same as in many cases of the flu or the common cold, and the different variants have different symptoms. So,
Hmm.
so you're going to have a lot of errors. But we have some
So
history of
same
this.
errors, same symptoms as COVID-19: cough, running nose, running eyes, fever, etc. All those things.
Well, yes, but yes and no. So
Okay.
more for Omicron, for example, it tends to start with a sore throat. With Delta, that
Hmm.
wasn't always the case. With
Okay.
the original Wuhan strain, you didn't get a runny nose. Now you do. So the variants matter. At the same time, even though I said Omicron starts with a sore throat, some cases it doesn't. And in some cases, Delta starts with a sore throat. So these aren't really hard and fast rules. They're just general guidelines. So if you show symptoms that are consistent with some kind of COVID, you have to layer on
Hmm.
top of that some other suspicions, like have you been to a place where you think an infected person was? Are
Okay.
you feeling these symptoms in such a way that is atypical for you because you know your body
Hmm.
best? Does a friend of yours or someone in your household have an exposure? Do you have a child, for
Hmm.
example, that was in a school with an outbreak? So that
Okay.
raises the probability. So combining the suspicion of infection with a sign of infection, in this case symptoms, that takes us above a certain threshold. Now, the important part here, though, is what do you do? What do you do if that's you? The
Hmm.
reason that I think symptomatic screening is useful is that if you're a regular person who's not an essential worker um, and you test positive for a PCR test, they will tell you stay home for 10 days, isolate for 10 days.
Okay.
Well,
Hmm.
if you're going to do that anyway, well, just assume you've got the disease and isolate for 10 days if you can. Right? So that way we remove the strain from public health. We remove the strain from the testing process. You don't have to go to the clinic to line up to be tested. You just do what you have to do. And as more people get infected, as they will, that's going to become the norm.
See. Now, that's like you said, this symptomatic screening. If we screen ourselves, we think we got, or I think if I have this new virus, what do I do? Sit home for 10 days, get some medication, go to the hospital, wait until it gets worse. It becomes now the hospitals don't want too many people going there because they'll be overwhelmed, and that's what our provincial health officer, Dr. Bonnie Henry, is saying. Avoid public places, but you really can't. You got to go grocery shop. You have to go to work. You have to travel in a bus. You want to. A lot of people do want to avoid public places, but there's no option for them. So what is now? How do we do? Just keep doing rapid screening or
If you have
rapid
access,
testing?
if you have access to a
Mm-hmm.
rapid test, that's a very useful tool. If you don't have access to a rapid test, as most people don't right now, and you're going to run out soon, then you do the best you can. So if you've got symptoms and they're not bugging you too much, you can just, stay home and wait it out. If it gets really serious, of course, you have to seek care in a hospital, and then they will give you a PCR test when you get there. If you have other people in your household, then they can go grocery shopping for you. But of course, if it's just you and
Mm-hmm.
you have to go grocery shopping, you probably
Yeah.
have to go grocery shopping. But to get curbside pickup, don't expose yourself to other people. There are tools in society that allow us to function without exposing ourselves to other people for just a few days.
Mm-hmm.
And frankly,
Now you pointed this out to AIDS crisis that happened in Bangui that created relying on the checklist. Now, can you explain a little bit on that? The people are very concerned and worried when we talk about AIDS and HIV. Would that be the same kind of problem with this virus?
well, I brought it up because we have a history of using symptomatic screening. And I
Mm-hmm.
use the Bangui definition as an example. So back in the 80s, before we knew that HIV caused AIDS, we knew that there was this disease called AIDS, but we didn't have a test for it. So,
Okay.
and even after we got a test, that test was not available in poor countries. So instead, what people did was they did symptomatic screening. They had a checklist of things that they thought were associated with AIDS. Kind of like, do you have certain sores on your body? Have you lost a certain
Mm-hmm.
amount of weight? Are you showing some other kinds of symptoms? A checklist of 14 or 15 things. And if you showed 8 or 10 of these, then we said you had AIDS. It's an
I
imprecise
see.
method, and it probably overestimated the number of AIDS cases before we got the HIV test.
So, in
But
closing, would it be fair to say not to panic until the symptoms get worse? You just sit and wait. If you can get the test done, well and good. If not, stay at home and try to kind of cure it itself. If it doesn't, then you go see somebody at the hospital.
yeah, I think you should avoid the hospital at all if you can. Whether or not you should seek testing, there are many reasons to seek testing. Maybe you have to go back to work. Maybe you're afraid of exposing yourself to like a child who's
Mm-hmm.
unvaccinated. Your individual circumstance will be different. But I think definitely we should not panic. Because I'm fond of telling everybody, this is not a reason for individuals to be afraid. Because for most people, if you get infected, you'll have a mild experience, especially if you're vaccinated. But at the
Okay.
population level, if enough people get infected, then we panic for the system. So think population, not individual.
And how dangerous is this virus in comparison to Delta? It spreads very rapidly. Yes, that's one thing, but is it something to be very much worried about?
That's a really good question, and frankly, we're not sure. So in South Africa, where this
Mm-hmm.
variant arose, there are reports that the doctors seeing it there see milder symptoms. But that's confusing because South Africa is a younger population. Their median age is
Mm-hmm.
27, ours is 44. And South Africa maybe has more immunity than we have because the virus has been running through them for a long period of time. In the UK, they're seeing an increase in hospitalization stays by about 40%. Sorry, a decrease in hospitalization stays, but a lot more people using the hospital. So my feeling is that it probably is a little bit milder, but not by a lot. And that means that even that because it's so contagious, it doesn't take a lot to overwhelm the hospital system. Yes, it's milder, but a hypercontagious mild disease can still be a nightmare.
Somebody who had two doses of vaccination, would their body be capable enough to fight this virus?
If you've had 2 doses of the vaccine, you're probably well protected against
Fight it out.
hospitalization, somewhere between
Mm-hmm.
40 to 70% effectiveness. If you've had 3 doses, you're well protected against initial infection and hospitalization. So definitely vaccination absolutely helps. It's our best way to prevent serious sickness and disease.
All right, thank you very much, Dr. Deonandan. It was a pleasure talking to you, and we'll be in touch with you before end of the year to get more updates on Omicron. Thank you very much.
My pleasure. Thank you.